Hi, it's Chris here from the Leicestershire training team. Did you see CQC's latest transformation? If not, don't worry, because we'll be covering it in this video. As of the 7th of July this year, 2021, CQC have updated the way they're actually going to carry out inspections on the entire healthcare industry. So why are CQC changing? CQC are changing because they're hoping that this new transformation will help them prioritise their activity in ensuring people's safety. They also want to introduce new aspects of their inspection, such as what is cultural competent care and how is it being carried out in care homes, hospitals and through domiciliary care providers. So with this new transformation, are you going to have to learn a whole new set of rules and regulations? Fortunately, you won't have to, because CQC are still following their key lines of inquiry, their CLOEs. However, what they want to do is prioritise 4 themes. These are people and communities, smarter regulations, accelerated improvement, safety through learning. Part of this transformation is CQC creating 2 core ambitions. These ambitions are assessing local systems, but also tackling inequalities in health and social care. So let's look at each of these 4 areas, starting first with people and communities. CQC want people actually involved in designing and improving your service. They also want your service to be focused on equality, diversity and inclusivity, but also be looking at environmental sustainability as well. And on top of this, we're also going to be looking at how well you're working in partnership with the local services around you, including the local authorities. Let's look now at safety through learning. CQC have placed many aspects in this ambition of theirs, ensuring that actually people develop this safety of culture, and they give us a little hint of what that actually means. For them, a safety of culture is everyone, not just staff, but also the people using the service, as well as local authorities or other external partnerships, all working together to create this culture, this sense of ongoing safety. So how does this get implemented? It's doing things that you are probably already doing, but making sure that you really do demonstrate it well, such as ensuring that your staff are well trained, that when you are recruiting them, they do have the right knowledge and expertise. It's really making sure you have this open door policy and this duty of candour really embedded in your organisation to ensure that anyone can speak up about any safety concerns at any time, and you have a robust system in managing this. Again, CQC have placed a lot of emphasis on ensuring people's human rights are protected, and also from this that you have a system of learning to not only find patterns and trends, but also ways to implement change and always continually improving your service. They actually make quite a statement. They say that services that aren't open to learning cannot be safe. This really does place such an emphasis on you being able to demonstrate your systems of learning, as well as how you're integrating yourself within the larger community to ensure you maintain safety, but also learn from it too. This really does affect this first key line of inquiry, safety. Now let's look at accelerating improvement. This continues to follow the CQC narrative of looking at the community at large, but also ensuring that actually when we are learning stuff, we're implementing it too. Finally, let's look at smarter regulation. It looks like CQC want to move away from this rating system which labels a care home for quite a considerable amount of time, For example, if you are requires improvement, you have that label for around a year. If you're good, you may have that label for around 18 months, and if you're outstanding, for around 2 years. They want to develop a much more dynamic and flexible system, which means that their rating systems are far more up to date. They're also wanting to concentrate on creating more appropriate responses to safeguardings or the outcome of inspections, but also better ways in which you as a service provider work with CQC. So what does CQC actually want for their outcomes? Well, they've labelled 12. From people and communities, they want their activity to be driven by people's experience of care. They want to clearly define quality and safety in line with people's changing needs and expectations. This definition is used consistently by all people and at all levels of the health and social care system. Thirdly, they want their ways of working to meet people's needs because they're actually developed in partnership with them. So under safety through learning, they have 4 outcomes that they want to achieve. They want improvement in safety cultures across the health and social care services and local systems that benefit people because of their contribution. They also want people to receive safer care when they're using and moving between health and social care services. So with safety through learning, they have 2 outcomes that they want to achieve. Looking at their accelerating improvement, they also have decided to have 2 outcomes. These are that they want to accelerate improvements in the quality of care, and they also want to encourage and enable safe innovation that benefits people or results in a more effective and efficient service. Under smarter regulations, they have 3 outcomes that they want to achieve with this new transformation. They want to be a more effective, proportionate, targeted and dynamic regulator. They also want to provide an up-to-date and accurate picture of quality. And they also want to make it easier for healthcare services and people who use that service to exchange relevant information with them. They also want to make it easier for health and social care services, people who use them and any stakeholders to actually exchange relevant information with them. And in return, they want to provide information which is accessible, relevant and useful. This creates 10 of their 12 outcomes. However, their 2 core ambitions also create an outcome each. One of these outcomes are that they want to contribute to an improvement in people receiving joined up care. Their other outcome is to actually influence others to reduce inequalities in people's access, experience and outcomes when using health and social care services. That's quite a big transformation for CQC to make, and they're being very keen on making it, but also leading by example and asking people for feedback as well, and then this helps shape their transformation. They also want to ensure that you as a service provider are actually doing that too, and they'll be checking to make sure that you're demonstrating that you're not only just working alone as a care home or a domiciliary care provider, but you're actually looking at the wider community, implementing new technologies, working in partnerships, and really putting the service user in the forefront of any changes that you make. They've made a real conscious effort to put safety first, asking you to create new cultures, to ensure that you implement any learning, that any new technology helps benefit the service in terms of safety and efficiency. And with CQC's own goals of ensuring that they actually provide you with this information, it's going to be really interesting to see what information they share to keep you compliant. Thank you for watching, and I hope to see you in another one of our videos.